Hey, it's Dr. Toby here. In this video, I want to answer the question, how long will it take to recover from a hip replacement? Now, by the way, if you stay tuned to the end, I'm going to show you some of the exercises that we use to help our patients heal from hip injuries, discomforts, and problems to actually avoid getting hip replacements and surgeries in the first place. So stay tuned to the end. And if you found this video helpful, like it and leave a subscription here with us so you can stay tuned to all of our content. Now, how long does a hip replacement take to recover? And this may be a helpful question to answer for a lot of people who have particular activities that they want to be able to enjoy that they're not sure if they'll still be able to do after they get a hip surgery, like being able to play golf or being able to continue to play tennis or your favorite sport, being able to continue to lift heavy at the gym, all those kind of things. Those are worries and fears that many people have, but I want to give you some insight to how long you can expect this hip recovery process to take, especially if you're already someone who's slated to get a surgery in the coming days or coming weeks. This video will be very helpful. And reality is that it will probably, for every individual, take a certain amount of time to get back to their 100%, and that time can vary. But generally, in the first 12 weeks, a person is going to be able to, be walking, doing a lot of the basic activities as far as daily things, going up and down the stairs, doing things that they were typically doing before. However, the difference and where the variation comes in for people depends on what kind of activities and what level of activities they're trying to get back to outside of everyday activities. So we have what we call ADLs, activities of daily living, things like getting up from a chair or going to their car and getting in and out of a car, going up and down stairs, doing things that are just general everyday things that everyone does, everyday stresses that are placed upon the body, which can be placed upon the hip. For most people, within the first 8 to 12 weeks, they're going to be back to a sense of normalcy when it comes to everyday activities like just going to the store, walking, feeling much better. And in fact, most of the times people within a day or two after the surgery will be discharged from the hospital, going back to home, things of that nature, and being able to get some type of home therapy, things like that. Now, the more important question is for the active individual, for the person who is avid golf player, playing 3 to 5 times a week, or somebody who plays tennis or wants to be able to get back to, playing their, with their grandkids or doing things that are above the average everyday activities. That can vary for people. And one of the things that's important to realize is it can sometimes take maybe 6 to 9 months before you're feeling that back to your 100% self, where you can do all types of activities at all levels, whether it's riding your bike without having hip pain and doing some more intense type of activities without having any limitations. And so one of the things we try to emphasize to people is that when you get that hip surgery, what it's going to address is relieving the pain that you've been feeling, most likely from arthritis or some kind of other hip degenerative condition. Now, the important thing to also keep in mind is that once you've been able to have that pain relieved, that doesn't necessarily solve the root problem that led to the arthritis or to the degeneration in the hip in the first place, which oftentimes comes from 3 things. It comes from weakness, it can come from wrong posture or movement patterns, and then it can also come from just having excessive weight. And so a lot of times people find that they got the hip surgery, they're feeling better, they can still sit without pain, they can do their desk job without having pain or discomfort. But when it comes to them being able to do the other more advanced things like going for a run or being able to play with their grandkids and pick up heavy items and doing things more repetitively and, lifting weights and squatting again, or being able to play golf for longer or playing tennis, those are the challenges that the hip surgery doesn't address. And even after people have gotten physical therapy, they're still stuck and struggling. So what do you do in that situation? What are some things that you can do? Well, you still need to get on a program to help you build your capacity to be able to do the level of activity that you want to do. And how do we get to this place where now we got the surgery, it relieved our pain, but it still didn't solve the root problem and give us the ability to do the things that mean the most to us, that matter the most to us? Well, we got to this place because we didn't do what we should have probably done in the first place, which was being able to prevent the surgery at all costs. And so a lot of times maybe you took in the pain medications, injections, and you went that whole kind of route, but it still led you to just getting the surgery. But I want to encourage you that there are other things you can do to actually prevent the surgery. So this is the part for people who actually want to prevent this happening in their life, going through a surgical procedure. Let's show you some exercises that will change the game for you. All right, so here are some of the best exercises that I can show you that will be helpful to begin. Now, a lot of these exercises may be advanced or more advanced than what people can do, but you have to regress these, and I'll show you a couple of the regressions that can help you to start with some of these exercises no matter where your physical ability is. So one of the biggest exercises that's important that we teach folks to be able to build that hip stability. This is a very advanced exercise, so there I'll show you some ways that you can regress it. So one of the things you want to do is build that hip stamina and strength here, right? You don't want your hip here. This is a side plank, and so what you can do is, again, not having the hip hang or sag. We want to lift it up and be in this position. Now holding this, right, is going to be great because we're going to be able to get some core activation here. That's going to be very beneficial and important. But one of the things we do to progress this is adding a clam or hip abduction. So lifting that leg up is going to be essential, because part of what happens when the hip collapses that leads to the pain we feel with arthritis and other things that lead to the hip surgery is that our hip doesn't have the endurance to stabilize and to stay in that optimal position. Now, for someone who has severe hip arthritis, there's a way that you can progress your ability, your strength to be able to get to the point where you can do this. But one of the things you can start off doing is just by doing a simple leg lift in this position, right? Now, imagine that this is the hip that I have arthritis in, right? This may be painful or discomforting, but that just is an indication that you need to first step back to a lower level exercise before you get to this one. Now, if this is the hip that I have hip arthritis in, I'll still want to do this exercise on both sides. So I'll still want to switch sides, be here in this position, and go from there to build the strength of this hip. So that way, ultimately, when I'm trying to challenge this hip, which is the arthritic hip, let's say, I'm going to be able to hold this position with, little pain, discomfort, and being able to do this and build that strength. Now, the way that we can make this even easier for people who have difficulty with this, again, every person is going to be different. And one of the things that you can do is, if you want to have an idea of what are the best exercises for you, you can hit the link in our description to talk to a PT first, to find out how you can actually prevent getting the hip surgery and getting the exercise program that's personalized and specific for you. So one of the things we can do is just a regular clam where our body's here and we just lift that leg up. It's going to be essential building the strength of those hip external rotators, because a lot of times where the muscles get weak that cause the hip to collapse, right? Now, the other exercise is going to be very essential, and this is where a lot of people will begin to find and discover what are some of the root issues that prevent them from actually having a successful hip surgery, where even after the surgery, they're still having pain, limitations, difficulty, or things like that. Is some of these exercises will expose what the root issues are. So you want to get into this plank position. And for some people right here, this may just be difficult, right? If you have your back is dipping, maybe you have a little bit more excess abdominal fat, right? What happens is that puts a lot of strain on your back, and your core muscles don't feel strong enough to hold you up. And that puts you in a position where you're already recognizing some of the root issues, right? If you're not able to hold your body weight, one of the things that we tell and explain to folks is that there are 3 things that are going to contribute to that limitation, whereby even if after you get the surgery, it's still not going to fix the root problem, and weight is one of those things, right? So if you get in this position, and then what you can do is do hip abductions here. This is really going to build that core strength and that hip stability, right? And we want to be able to do this from both sides. So one of the things that we'll do is to be able to get the left leg or the right leg, because the leg that's staying on the ground, that hip is being challenged, right? So how can we make this exercise a little bit easier? Well, one of the ways that we can make it a little bit easier is being in this position, bend our knees a little bit, and do that, right? So there are a couple of ways we can vary this exercise. We can even try to go to this variation where we're in this position. Still gonna be a lot of challenge for some people, but having the knees bent in this like bear crawl position is what we call it. We're here in this position, and moving that leg out is going to be great for encouraging hip stability and endurance. So those are a couple of exercises that we do to show. There are so many variations, so many types of exercises that can be very beneficial and helpful to get you out of that place where you're no longer even having surgery as being a part of the conversation or in question, because you're feeling much better and able to do things at a high level. So the goal is not only to relieve the pain, the goal is to address the root problem. And once you begin to do that, then you'll find that you can still do activities like golf, tennis, lifting, running, doing all your favorite activities, because you address the root issues that are leading to the arthritis in the first place, not just addressing the pain that the arthritis or the hip issue or injury is causing, which is just a secondary result. So hopefully you found this video helpful. If you did, give it a like and leave a thumbs up. Leave a comment as well on what you found most helpful, and subscribe to our channel so that you can stay up to date on all the information that we share to help you stay healthy, pain-free, fit, and mobile, and to live a life of confidence so that you can be your happiest and healthiest version of yourself. See you in the next video.